My name is Sandy Pack, and today I'm going to be teaching you how to start an IV. When gathering the supplies to start an IV, you will need an IV start kit. Typically, it'll have a tourniquet, a tegaderm, some tape. Next, you will need to pick the appropriate gauge needle. You will also need to get an IV extension tubing. Many IV start kits may contain it. I like to have an extra set of alcohol swabs, 4x4 gauze, and an IV push of normal saline. So the first part of starting an IV is, of course, to hand sanitize. And before I open up all the supplies, I like to first take a good look at the patient's IV site, potentially find a good vein. And for us to be able to do that, we will need a tourniquet. Inside the IV start kit is where we find the tourniquet. During that time, I'll ask the patient if they have any allergies, because many IV start kits will contain an iodine packet, and we'll set that aside since we only are going to be using alcohol today. Next, we're going to apply the tourniquet. I like to first tighten the tourniquet before touching the patient with the tourniquet, pull, and then tuck, so that we avoid causing the patient any harm or unnecessary discomfort. Now that the tourniquet is applied about 3 to 4 inches above the insertion site, I like to use my non-dominant hand and try to feel for a good venous access. In this particular case, I see that this patient has a really good AC vein, and it's appropriate to start an IV, and so I go ahead and release the tourniquet. And now we're ready to set up our supplies. We should never leave a tourniquet more than 2 minutes on the patient. Now we can open up our supplies and get our setup ready to start an IV. I like to open up the extension tubing and remove the protection cap. From there, we're going to open up to the saline flush and remove the cap and push out the excess air and place it inside the extension tubing packaging so that it's available. I choose not to attach it just so that it's easier to handle one-handed. From there, I'm going to separate the gauze and have close by in case we need it. I like to prepare about an inch size piece of tape and have the additional tape close by. So now that we have majority of our supplies set up, I'm going to now put back the tourniquet on the patient. Again, I like to tighten before touching the patient and twisting and then tucking, avoid discomfort about 3 to 4 inches above the insertion site. Now is a good time to put on our gloves. We're going to go ahead and open up our IV needle. In this particular case, our patient needs just a 22 gauge. I'm going to go ahead and bend and snap off the protective cap and verify that our needle is intact. I'm going to go ahead and place my fingers and verify the bevel is up, and then loosely connect the cap and get it in position for our patient. Now that we're ready, we're going to go ahead and re-clean and verify that our patient's skin is prepped and ready for IV insertion. Pulling down the skin taunt with our non-dominant hand, I'm going to go ahead and refill and verify the access site. We're going to allow about 15 to 25 seconds for the alcohol to fully dry. We're going to get our positioning of the IV, take off the cap. We want to place our thumb and third finger on the sides, as well as our pointer finger is going to stabilize the needle. And at a 10 to 15 degree angle, we are going to approach, let our patient know they're going to feel a small poke, and insert our needle. Once we see a flash of blood, we're going to lower to a smaller angle, less than 10%. We're going to push in our catheter. We're going to go ahead and pop off the tourniquet, and now we're going to pull out the needle, making sure we apply pressure just above the insertion site and securely hold and attach the extension tubing. From there, we're going to utilize that 1-inch piece of tape just to hold in place our IV start here. Next, we need to verify blood return and placement. To do that, we are going to attach the normal saline flush and we are going to pull back. We should verify that the tubing fills entirely with blood. Once it does, we are going to go ahead and push the blood back with normal saline and flush that IV extension tubing, and looking and verifying that it is truly in place and that the patient doesn't have any pain or tenderness. At that point, we're going to just verify that it is securely attached. We are going to tape and secure utilizing the Tegaderm. Once that we have the IV securely placed, it's important to remove the additional packaging and be sure that we for sure date, time, and initial when this IV was started. Many facilities will ask that you also include the gauge of the needle. We'll attach this here to our patient and use the additional tape to verify that our patient has the IV secure and in the right place. Once the IV is started, we can go and make sure that we pick up our supplies. And that's how you start an IV. Just remember, push, pop, pull. Push in the catheter once you see a blood return, pop off the tourniquet, and pull out the needle. Thanks so much for watching. This is Sandy Pack.